The COVID-19 vaccine is currently in full distribution, available to anyone 6 months and older. Many have viewed the vaccine as a light at the end of the COVID tunnel, but for others, myths regarding the vaccines give rise to skepticism and uncertainty about the safety and effectiveness of getting vaccinated.
The vaccines were developed too quickly, so they can't be trusted.
The vaccines that we have for COVID-19 are based off of decades of research. So while it might have felt that those vaccines were put together quickly, really there's decades of research behind it that helps support that technology and help us to create those vaccines.
The vaccine contains the coronavirus, so getting it will give you COVID-19.
The COVID-19 vaccine cannot give you COVID-19 disease. You cannot contract the virus from the vaccine. So what the vaccine does is it puts a part of the protein from the virus called the spike protein, or shows you different parts of the virus to your immune system. So that way it knows and is able to recognize the virus and be able to fight against it in the future.
I already had COVID, so I don't need the vaccine.
So for individuals that already had COVID, it's still recommended to get a COVID vaccine. The vaccine still shows that there's a reduction in hospitalizations, death, and overall COVID severity. There's also evidence showing that individuals that haven't been vaccinated, even if they had COVID, that they're still at higher risk of getting COVID again compared to individuals that have been vaccinated. For those reasons, even if you've had COVID in the past, it is still recommended that you get your vaccine.
The COVID-19 vaccine alters your DNA.
The COVID-19 vaccine cannot alter your DNA. The mRNA vaccines do help to code for proteins that your immune system can then be aware of, familiar with, and be able to fight against COVID better. But the particles from the vaccine do not enter the same place where your genes are housed, so they do not get incorporated into your DNA.
COVID-19 vaccinations can cause infertility or miscarriage.
COVID-19 vaccines have not been shown to cause infertility or miscarriage. What some individuals might experience is after having their COVID-19 vaccine, they might find some alterations to their menstruation or to their period, but those alterations are short-term and have not shown any effect on fertility or on effects on getting pregnant in the future. While the COVID-19 vaccine has not been a link to infertility or miscarriages, actually COVID-19, the disease itself, has been linked to potential challenges during pregnancy or during childbirth. So in order to avoid some of those complications for women that are thinking about getting pregnant or who are pregnant, COVID-19 vaccine might be even more important for those individuals.
When the COVID-19 vaccines were first released, appointments were hard to find. Now it is easier than ever to schedule one.
Vaccines are available throughout the county, so you might consider going to one of your local pharmacies, whether that be a CVS, Walgreens in your area. You can also talk with your healthcare provider. So your healthcare provider might have vaccines available, and there are also opportunities through public health. It's important to talk with your healthcare provider of all those different options that you have to keep you healthy, keep you out of the hospital, and to ensure that COVID-19 doesn't affect you in any severe way.
Keep yourself and those around you healthy by staying informed and taking action by getting vaccinated.